Hi guys, welcome back to my channel. How are you guys doing? Today I want us to talk about preparing for your first clinical in nursing school. Before I start, if you are new to my channel and you're just seeing this video for the first time, I welcome you. My name is Barbara Wilson. I make video from Northwest Indiana. I am a registered nurse. I talk about nursing, NCLEX exam, nursing world, how to prepare. So I hope you really find this channel educative and informative. And please like, comment, subscribe, tell others about our channel, tell them what we do, and we will appreciate it. Okay, so today we want to talk about how to prepare for your very first clinical. I'm going to give you 4 points of things I think you need to know before you go for your very first clinical in nursing school. Number 1, before the day of your clinical, you want to get to know the site, know how to get to the site and know the site. Why are you doing this? Because you don't want to be late. The way nursing school work and the way clinical work is, they give you like 5 to 10 minute grace. You cannot be late. If you are late, if it was my kind of school, they will kick you out. Sometimes they give you grace for the very first day, but you don't want to be late. It's your very first day of clinical. You want to be there, get those information, and be ready to go. So you want to, few days or few weeks or a day before the clinical, just drive around the clinical site, drive around the hospital, get to know the hospital, get to see it, get to know where to park, just get to know your way. And you will see that will help you when you're going to clinical. You will be able to get there a lot more faster because you already know your way around it. Second thing I think you need to know for clinical, you need to be professional. You need to dress professionally. You need to have your material ready. Number 1, you need to have your stethoscope ready. You need to have your blood pressure cuff. You need to have your ID name band that the school give you. You need to make sure that your scrub is clean, is well ironed. You cannot wear dangle earring like this. Your earring needs to be hooked earring. You need to have your hair packed up. You cannot have your hair down. It is not a party. It is a clinical. It is for serious business. And they will be strict about that. Usually, when you go for your general nursing orientation, they tell you these things. But I want to let you know that they will uphold those values. When you get in there and you are not looking professional, they will send you back home. So you want to know this stuff before you go to clinical. Have your watch, have your stethoscope, have your blood pressure cuff, have everything ready. Have your uniform clean, neat. Your shoes needs to be clean. It cannot be flip-flop. It cannot be open toes. It has to be a closed shoes. That's the second thing you need to know. The third thing you need to know is that on your very first day of clinical, don't expect that you guys are going to have clinical for the entire 8 hours that they gave you. Most of the time, your first day of clinical, they tend to let you guys go early. On your first day of clinical, they do like a tour of the hospital with you. They tell you the policies, the rules. The nursing instructor, when you guys get there on your very first day of clinical, she might not start right away. It might take her like 2 hours before she starts. She will go upstairs. She will go talk to the nursing managers. They will try to figure out which patients they can pair you with, depending on the level you are in the nursing program. Of course, if you are towards graduation, they're going to put you with, critical patient, but I'm talking about your first clinical here. So the nursing instructor will try to find a balance, which nurse to pair you with. So don't expect her to start right away when on your first day of clinical. It might take a while before she start. She's probably going to discuss the rule, like I said before. She's going to inform the policy. You want to have your notebook take a notebook with you and a pen, because they might give you password for computer and you want to make sure you have that down. The fourth thing you need to know about clinical experience is that on your very first day of clinical, don't expect that the nurses that they're going to put you with are going to be very welcoming. Okay, they don't know you. They are just getting to meet you for the first time. Don't go in there thinking that, oh, you're going to get to see this, you're going to see this, you're going to be with critical patients. Don't forget, it's your very first clinical. Even if they are not nurses, even if it's just other people, it takes a while for people to get to know people and loosen up with people. So don't expect those nurses to show you everything. I have been a nurse on the floor, and I know that it is not easy to try to take care of your patients at the same time teach nursing students. So sometimes it's more of like a burden on the nurses. Some other nurses, they welcome it. They are excited to have students. But I'm telling you this so that you're not surprised that your nurse that they pair you with is not showing you everything. It's not like, oh, let's go. She's not doing that. It will take a time for her to get to know you. It will take a time for her to get to see what your skills are, what you can do. It will take a time for them to loosen up. So you need to just know that, so that you don't take offense or you don't get angry. Just have an attitude that you want to learn. Have an attitude that I'm going there to learn. It doesn't matter how the nurses treat me. I'm not saying they're going to treat you like they don't want you, but don't forget, it's their license. At the end of the day, you are going to be training under their license. And if anything go wrong with the patients, they're going to be held responsible. So they're going to want to know that you know what you're doing before they let you go. So it's normal. You're going to see that they're not going to like open up to everything with you. They're constantly monitoring you. Just go with the flow. Like I said, have an attitude of learning. Be ready to go and you will do fine. I just want you to know that clinical is a much more stricter environment than class. They are very professional. They are very serious. They are not going to take any attitude. You have to watch your attitude. You can't go in there be disrespectful. You cannot be loud. You cannot go in there and be cussing another student out. They do not tolerate all those attitudes in clinical. They will click you out. They are very serious. It's all about the patient and you learning. So go there with a professional understanding of the fact that you're going to take care of somebody. You're going to deal with somebody's life. They are not there to play with you. They are not there to be your friend. They are there to train you, to teach you, for you to ask questions, and for you to be a better nurse. That is basically it about the things you need to know for your very first clinical. Thank you very much. I hope this little information I gave you help you. Like I said, if you're new on my channel, please like, subscribe, help our channel grow. We will appreciate it. You guys have a wonderful day. Goodbye.